How are you? My name's Joseph Winter, and I'm a physical therapist at Center for Physical Therapy. Today, I'm going to be discussing patellofemoral pain, commonly referred to as anterior knee pain. 2.5 million runners are diagnosed with anterior knee pain annually, but it's not just a diagnosis among runners, it's also common amongst weekend warriors. I'm going to give a brief overview of the patellofemoral joint. The patellofemoral joint is made up of articulation between the patella, or the kneecap, and the femur bone, the thigh bone. So the patella, in full extension, sits up high on the distal femur. And as we bend our knee, what happens is the patella tracks in between the groove on the femur, where it will eventually sit into the intercondylar notch. The back of the patella is aligned with articular cartilage. This allows the patella to glide smoothly on the femur when tracking. Patellofemoral pain typically presents with pain along the medial or lateral border of the patella, and it'll travel to the inferior pole of the patella. And activities that increase patellofemoral pain are squatting, going up and down stairs, or standing after sitting for long periods of time. First, we look at the source of the pain. What can happen is we can have a muscle imbalance along the knee. Laterally, we can have tightness in the vastus lateralis and IT band, along with weakness medially of the VMO. This can lead to a maltracking of the patella, and it can lead to breakdown behind the kneecap. After we clear the source of the pain, then we want to look distally at the foot. Common faults at the foot is overpronation during activity, which can lead to rotation of the tibia, or on the opposite end, high arches, which can also lead to lateral rotation of the tibia. Both of these will cause maltracking of the patella. Common treatment for anterior knee pain are initially to eliminate the exercises that's causing the stress to the back of the patella. So, one would be rest. So if you're running and that's causing the increased pain, eliminate running for a period of time. Icing during this time period can also help reduce inflammation that has built in the back of the patella. Next would be starting some rehabilitation exercises that can help strengthen or stretch the muscles that are the cause of the pain in the knee. The first one we'll do is a series of straight leg raises. What you're going to do is you're going to keep one knee bent, the other leg nice and straight. Next, you're going to contract the quadricep and you're going to lift up to the level of the other leg. On top of that, what we'll do is slightly externally rotating the leg, or rotating the leg outwards, can help us focus on the VMO, or that muscle that many times is weak along the inner aspect of the knee. Doing the same type of movement as just demonstrated, John will squeeze the quadricep and lift up to the level of the other knee. Doing this daily can help strengthen that VMO. Next, in this position, John's going to straighten his leg parallel with the rest of his body. Keeping the leg nice and straight, he's going to lift up about 10 inches towards the ceiling, hold for a second, and then down. This motion will help strengthen the muscles on the outside of the hip. In this position, John's laying nice and flat. He's going to tighten his glute muscle, and he's going to lift his leg only about 5 to 6 inches off of the table. We don't want to lift too high, because when John lifts too high, then we have actual compensation through the lower back. Lifting slightly, hold for a count of 2 seconds, and then down. On top of the exercises that were displayed, hamstring flexibility and IT band flexibility is important as well. So stretching the hamstrings and the iliotibial band can also benefit in your recovery to anterior knee pain. Next exercise we're going to demonstrate is a mini squat with Thera-Band around the thighs. When performing this exercise, what we want to focus on is keeping our knees in nice alignment with our toes. So as John demonstrates the exercise, you'll see as his knees are in nice alignment right above his toes. One common fault that occurs with this is rotation of the knees or knocking of the knees as you're squatting. This is something we want to try to avoid. John will demonstrate a faulty movement pattern. As you can see there, the knees are rotating in slightly. And now I'll have John demonstrate a normal squatting exercise. Again, nice normal neutral alignment of the knee. This exercise is called a monster walk. What we're going to do is have John go into a slight squat and just walk laterally side to side. This is working on the muscles on the outside of the hips. If your pain symptoms continue, I would contact your local physician or physical therapist for evaluation. I'm Joe from Center for Physical Therapy, and that'll do it for this week's Weekend Warrior Tip.